It may take some time before medical personnel and residents see any real improvements in care and service at the Okeu hospital. Last week, the St. Lucia Medical and Dental Association (SLMDA), in a missive, raised concern about the supply of basic drugs and medical supplies at the Okeu hospital. The SLMDA's president, Dr. Mole Clark, in a recent letter to hospital management, described the situation as, quote, unacceptably dangerous, end quote, claiming that many patients are refusing care at the facility. Public Service Minister Dr. Virginia Albert Poyet was pressed on the matter at the weekly press briefing. She warned that it may take a while before residents start to see any changes take effect at the Okeu hospital, but the government is working on speeding up the process.
Once a situation has reached almost a crisis level, it will not change overnight. And I don't want people to believe that by tomorrow you will see a big transformation at Okeu and the way people do things. But I can give them the assurance that the government is very mindful of that. And the Prime Minister has made commitment. Even the first meeting we had, he did commit to additional resources. So it's a matter of the process, and we need to expedite the process. I actually spoke to the PS of Health at the awards ceremony on Saturday, and I did draw something to her attention that we need to expedite the process. So I will be fully supportive of any suggestions coming from Cabinet to improve the situation at Okeu.
Dr. Poyet reiterated that Prime Minister Philip J. Pierre has vowed to allocate more resources and funds to help improve conditions at the hospital.
Interestingly, as you said, you got wind that we'll be meeting them this morning. But prior to that, we had already brought management of Okeu and St. Jude to a meeting with Cabinet just a few weeks ago to address the very issues that were raised by the Medical and Dental Association. So we were one step ahead in terms of addressing the matter. And the Prime Minister has made a commitment to invest a lot more in providing some of the supplies and services that they need at the hospital. So I'm very confident that coming out of the meeting today, that we will see some greater improvement in the matter.
Prime Minister Pierre, addressing the Okeu situation at the weekly media briefing, stated that he would prioritize the SLMDA's concerns in the coming days.
The SLMDA wrote a letter which I'm going to meet them this afternoon on Tuesday to discuss the letter. I've said before, I want no conflict with any doctor or any nurse or any health worker. The SLMDA they've had concerns before. These concerns are not new. We understand it, we empathize with them, and we're going to meet them to see if we can have an approach to alleviate these circumstances. The first issue was the emergency services at the hospital. I met with them, and we decided that we're going to immediately look for some more space for the emergency ward. Immediately. That work is supposed to start anytime now. I empathize with the nurses and the doctors. I understand their concerns. So I want to assure you, Mr. Romulus, that we're going to meet with them tomorrow, and I'm going to use the government's best efforts to alleviate the condition. But we understand what we're saying, and we understand what they're saying, and we want to alleviate the condition, but we want to work together with them.
Residents have also complained of poor service and care at Okeu's emergency department. The Public Service Minister disclosed that the government will be pumping more resources into soft skills for training of medical personnel. The SLMDA called on hospital management to improve conditions or step aside for new leadership, warning that physicians are at a breaking point. Gina Filippi, HDS News Force.